Hi, I'm Karen Lindley from CIBA Vision. I've been with the company for over 20 years. I work in research and development. I work with chemists, biologists, microbiologists, engineers, and physicists. So it's a little bit of a different model than what you all have been seeing today in the presentations. Just a little background on our company. So our mission is basically to have a shared passion for healthy vision for a better life. We're a global company. Worldwide headquarters are located in Atlanta. We have R&D facilities in a couple different locations throughout the world, although the Atlanta facility is the headquarters. We have about 5,900 employees around the world. The vision care industry is actually growing. Surprisingly, only 2% of the market wears contact lenses, and that equates down to 125 million contact lens wearers. So there's room to grow. There's lots of potential in this area. Most people like to wear contact lenses. The top reasons are for appearance and convenience. Go ahead. Our portfolio, we have a number of different portfolios. We break it down. We have contact lenses that you wear on a monthly basis and then take them out every night. Some of them you can actually sleep in. We have daily contact lenses. This is the brand and the research project that I'm working under in this brand. These are the type of lenses that you put in every morning and you throw out every night. We have colored contact lenses to change the appearance of your eyes. And then finally, we have lens care that can help take care of those lenses. So now our program is what we're working on. We have the program charter that we had really demanded innovation and from the very beginning. We were looking for innovative chemistry with new materials. We needed an innovative manufacturing process. Had to have high throughput, looking for low TPCs. We had to go through scale up of this chemistry manufacturing lines and facility. We also needed to encompass product testing and clinical trials that would support our global regulatory approvals. Marketing materials and our programs needed also to come in. We're looking at doing different ways of marketing and tracking our consumers. Those are the people who wear contact lenses, and our customers. Those are the doctors and eye care practitioners that prescribe our products. Our implementation charter for this program was to synchronize a global project team, provide real-time visibility of the health of our project. We needed swift and relevant communications to our program steering committee and really made sure that the team was focused on the right priorities and had a clear priority list to work from. Lots of things were competing and giving us obstacles. So on the left-hand side, you can see we have a global project team. So this particular team is split between Atlanta and Germany. So not only do we have a location issue, there is language, culture differences, highly complex project, as I already outlined, because we were touching a number of different areas in the company. Multidisciplined clinicians have different goals than engineers. Microbiologists have different goals than marketing people. Lots of uncertainty and technical risk, because really when we implemented this, we were still at a lot of the invention phase of the program. This is one of the largest programs that we have going on in the company, so we really needed some good way to justify our resource allocation, because all you heard was our project was consuming all our resources, and it was really difficult to justify that. Another problem that we had was if we ran into a problem, since we were trying to invent while we were implementing the critical chain program, and we hit a problem, something happened. It was difficult to model or to really understand what the true impact of the overall program would be. We were already late. We were already overspent on our budget. Everything was a constraint. We really didn't know where we should focus our efforts at the time. So we really needed something that could give us some visibility to that. So our implementation plan, we partnered with P3 Consulting Group. P3 was selected because they were already working with our Novartis Animal Health Group with a successful implementation there. We sit in the same division as them, and so they came over and helped us. And what we've done is, for this program, is it's the only program in our R&D organization that we've actually implemented critical chain. So there's a number of parallel programs that are running outside of the critical chain implementation. Our program is supposed to be the pilot for the rest of the organization. What we did in our implementation is we scheduled 2-day training workshops with both teams. So we all flew over, like a sub-core team flew over to Germany. We pulled everybody in that was working on the program, and we did a 2-day training with them. Came back into Atlanta, and we pulled all those folks too. And in fact, at that point, we were pulling marketing people, supply chain people, purchasing people, as many people that we could, just a touch to try to go over the theory of constraint, the theory of constraint and the critical chain. Thank you. Why we're here. So we also thought that our executive steering committee that's monitoring, that we have to report to on a monthly basis, since this is a new way of thinking of the project. So we went through and did some series of training programs, and then we actually had Bill sit in on meetings and reviews to kind of help, touch points back into the theory of constraints concepts and the critical chain concepts. So once we went through that, that was over about a 2.5, 3-month period. We went then into identifying our key team members. We did intensive training with them on the project management skills that went behind it, the Concerto planning tool, and the ConWeb system. And then we spent many hours in a conference room with no windows and hot, coming up with our project plan. We took this project plan. We had an engineering project plan, we had a clinical project plan, and really worked to pull it all together. And the next part of the implementation phase is where we're at now. So at the beginning, we did weekly coaching sessions. Either Bill would be physically with us or on the phone with us as we went through our active task management meetings. And we would go through that, and he would coach us or challenge us as we were going through so we could continue to learn the skills. We also do monthly one-to-one mentoring, so I'm over in Germany with my project manager over there, and one-to-one we work back and forth and play off each other to try and see what's working for you, what's working for me, and try and figure out a best practice. And peer-to-peer meetings are also a great way to do that, and I also want to call that as like peer pressure. During one of our sessions, what we had is someone kind of new to the group. They're not a project manager, they're sort of a resource manager that sits in, and he was reporting on one of his resources he was responsible for, and I just kept getting every week, week after week, 5 more days. Yeah, I can finish this in 5 more days, and then 5 more days. And finally, my other project manager and I, we looked at him and said, no, that's not what we're looking for. We're looking for you to challenge them. We need to see this reduction. We really need to get at completing these tasks. And it was quite an interesting thing because the guy kind of looked at us. We were in Germany, and he's a German counterpart. And just out of frustration, he just kind of looked at me and said, he didn't quite get it. And so my German project manager, I just looked at him and said, tell him in German what we need him to do, because we really need to complete these tasks to get them done. So I'm going to go through some of the before and after scenarios, and then some of the benefits that we saw when we implemented this project. As I said, we had multiple project plans. So the engineering team had design a new manufacturing line, buy all the parts, build it, and get it running. We had the clinical team who was more worried about when am I going to get lenses. This is the kind of clinical studies I'm going to do, and yeah, the reports will come out. Regulatory was just sitting there waiting. Marketing, well, they just color outside of the box and outside of the lines, and they're still very difficult for me to pull in. With the exception of marketing, we've been able to pull everybody into a single project plan. Now, after sitting through the master's class yesterday, and they said 200 to 300 lines on the plan, yeah, so I have to confess our project plan is about 700 lines, and the marketing people are threatening to put it up to 1,000. So I'm working with them. But it seems like a lot, and I really reflected on that last night, but because we had so many different things going on, and everybody, the program is so interconnected. We needed a line to give us the lenses so we could do testing, but then we needed some early data to tell us what controls on the line to do, and so in the end it worked out that we had to have this massive project plan to really see where the touch points were for everybody. And it really gave us some visibility to the functions, the function-to-function interaction. we used to sit with, like, sort of like the guy from Siemens said, right? You build a project plan and then you kind of look at it and dread it. And every 2 weeks we would sit down and go line by line through everybody's project plans and try and update start and finish. And it was just really okay, this is going to start here and this is going to finish here. And not really not really challenging anything, just simply updating. It was a very painful process. Now what we've come to, the rhythm or a project that really works is a weekly update meeting that we have right directly in ConWeb. We do a teleconference and we do a WebEx too. So we're all looking at the same screen at the same time. There's about 5 of us. We've taken the project, we've divided and conquered. We can get it done in 45 minutes, and I mean at times it's even 20 minutes. It is the richest discussion on what's going on with the project. I always tell people if they don't know or want to know or concerned what are the watch-outs or the hurdles, we invite anybody to sit in and listen. It's amazing what you find out. So I really do know what is the underlying issues that are going on for the project that then we can signal that we need more resources and more focus in some things. We used to do passive task management. Jim, when are you going to be done with the study? Okay, in 2 weeks, that sounds good. You go away. Now we really try and go back and challenge those with this active task management feature. That ConWeb system where it prioritizes the work that you're working on is great. When things come up and they bubble up to the top, and you're like, we really need to go after that and figure out how can we shorten the duration, or what can we do to protect these resources to make sure we at least preserve what they've budgeted for their time. There's a couple instances where we have one instrument that'll do the measurement, and that's it. Well, that instrument in a research organization, we're just a 9-to-5 group, and then there's, the real researchy people that'll maybe work the longer hours, but most people are 9-to-5 on a research organization. And Bill was there, and he really challenged us on that. And what we discovered was, well, if there's one instrument, and that instrument only works 9-to-5, what's happening the rest of the time of the day? It's just sitting idle. So we went in with the work team, and were able to go in and split a shift. So we went in into the lab and asked the folks, hey, do you think you could maybe come in and work 6 to 3, and another group work 9 to 6? Gave us a little bit more output, helped us preserve durations in what we were working on, and ended up being a real success for us because it got us some information that we were really waiting for to make a key purchasing decision that we had to make later on. For functional resources, so for this page what I did was I interviewed a couple different people that are working on the project and asked them where did they see the benefits themselves. So as my customers and how they thought it was going to be, how they thought it was useful. So some of the examples are a lot of times people in a functional area were working on what they perceive to be the priorities. So, and especially in our organization where it's only my program that has the ConWeb system, a lot of other project managers are running around going, this is really urgent, this is really urgent. So it made it really difficult to figure out what really should I be working on. I always get feedback now from my resource managers, the fact that I can come in and accurately forecast when am I going to be there, what resources do I need, what do you need to queue up, what do you need to have ready. That visibility is great because now they also have some objective proof for those other project managers to say, sorry, Karen's project is coming in, we have to clear the decks and we need to complete this. One other benefit we saw from this is our procurement and accounting team. We have, it's a pretty capital-intensive project for our company, and so we didn't want to needlessly spend money ahead of schedule. And so looking at delivery times and what was really needed, we were actually able to delay some of those CapEx expenditures as opposed to what was a perceived urgent need to do that. Now we are spending our money prudently aggressively prudent, one of those two. But we also wanted to make sure we were spending our money at the right time. So we found out that this really helped us prioritize what needed to spend, only spend money what we did, and probably delayed about 25 to 30% of those expenditures for when they really needed to be done. We had a lot of people who were multitasking, and we also had limited visibility for priority of the resources. We found that with using this Conweb system that it allows us to simplify that priority list. It really is a nice feature if you can teach your resource managers to go in and look at it. It gives them a list of, like, you know, depending on what window or what time frame of 10 things they need to be working on. It's a very simple function to do. You can say, here's a red one, here's a green one, here's a yellow one. I don't want you to tell me you're working on the green one. I need you working on the red one. It also gave me a way to go in and really challenge how they're doing that. A lot of people have also told me what they found with this is that this whole full kit mentality has changed the way people have worked. People would start working ahead. Oh, I know you're coming, let me write my protocol and get everything done. In the example that we have recently is like the clinic had already written a protocol to do some testing on that, but we were still making process changes. And our clinical protocols had to be very specific to how the lens was made. So, yay, your clinical protocol is written and approved, but it doesn't reflect where we finally ended up. So what we found by making sure that these people were connected and they understood where the decisions and where the inputs were coming from, that they could stop. And what it says, the protocol could be written to a point, they could hold it, and when the decisions came in from the engineering and chemistry team, they could then finalize that protocol and go forward. So they felt like they've reduced that unplanned rework that they've had. And the last example is, and I've heard something similar here today too, is our suppliers on some of our manufacturing lines used to manage the timelines. They would say, please build this for us, and they would say, okay, we will deliver it to you in 6 months. And in a project, as you all know, that's late and over budget, you know, you just can't live with a, okay, I'll wait 6 months for you to deliver it. Since we are inventing this manufacturing technology, what we did with this vendor is I said, we funded them and we said, we're buying one. We know we'll need more. If you're successful, you know, we will buy the rest of them from you. And so they went in and talked to the vendor. They took the training that Bill gave them and went and on their own and met with the supplier and went through some of the concepts of theory of constraints and critical chain, and came to an agreement that CIBA Vision would own the buffers and put the cut durations down, gave that to the supplier and challenged them to deliver. They did a weekly review with that supplier to make sure where the project was, really challenged them. We also, similar to what we do internally, they did challenge those suppliers to make sure, could we get more resources? Do you need this? Do you need that? Can you hire an external consultant yourself? In the end, what's happened is we've successfully able to shorten that delivery timing with that partnering effort. And so we took something that was going to be a year in delivery and brought it down to like 9 months. And so we got the first unit in almost a year ago in December, and we've purchased the second one. And from even there, with that negotiation and the close commitment that we've had with this supplier and co-development with them, we've actually been able to shorten further. The second unit is actually coming in faster than the first unit. So overall, what did this CCPM do for our project? So it built a global plan and synchronized our project team to our product launch. Everybody's now focused, the launch. What do we have to do? As opposed to being individually focused on what their organizational function was. Strategic buffers really help us absorb a lot of uncertainty. And in that, it's kind of interesting because recently, one of the examples I have on that is, you know, we're not great at buffer recovery. We seem to be very good at consuming all our buffer. But what happens is we recently put the line all the way together and ran it 100% through, and lo and behold, we ran into some issues. But what this allowed us to do, the system is we came back, we had to come in, invent, fix our problem, modeled what the set of activities are that would get us back in line. We actually checked out the project, put the new plan in, checked it back in. There were like 3 different work streams that we had, and everybody was running around going, everybody has to be working on these 3 work streams. Put a little bit of buffer when we put them back in because we want to protect that end day. What we found is no, all 3 work streams don't have to all be released at the same time. If you focus on the first 2, the other one can lag a little bit so we can let them focus on another area of the project to go forward. So that visibility within the program has been really nice. We look at that project critical chain all the time. What can we do? What can we do? What can we do? What can we do to protect it? What can we do to shorten it? We are very keenly aware of the work streams that are critical to the launch. It jumps for us. And a lot of that has to do with if another work stream is running a little slower. What we found is there's probably about 3 major work streams that we have in our project that are within a week of each other of being the critical chain. And so we really have to monitor all those. Before we didn't have that visibility. You would be focused in on just building the line, and then you would forget that if you didn't protect the clinical studies and keep those in check, then that could be driving out the end date of the project. So that system of prioritization was really nice to have. Early warning signals are nice because these things, these hidden chains, hidden theme chains that you weren't maybe actively monitoring now become up in the top 10 things of what you're monitoring and going forward. We use this system to provide feedback to our executives and our steering committee. It's allowed us to make quick decisions. When something goes red, something's going yellow, something's in crisis, I've been able to go in and say, see, look, this is objective proof of what we've got. And they can make good, it's an easy and fast communication tool for me. I can get them to move people. We need these 3 people from Atlanta to go to Germany for 3 weeks. And, you know, they're like, well, they used to be like, well, we really don't want to spend the money, and can't you do a teleconference? And I'm like, no, this is why. We're going to be late. We have to get this done. And it gives me, and so these tools have been able to give me that objective proof to say, see, look, if we don't, we're going to end up having some delays. My favorite, and this is actually another recent one, is that the whole concept of critical chain, theory of constraint, full kitting has really changed the way the team has approached actions within problems that we encounter, risk reduction. It changes the way that they're all talking and communicating with each other. They've said to me repeatedly, we cannot go back to the old way of managing projects. We've got to keep the system. How do we keep mentoring and fostering this concept within the organization so that we can push this forward? Because there are definitely pockets that are seeing great successes with it. So on the project plan, what did I learn? Be realistic before we start cutting. We first loaded into the project plan what I call a skinny plan. So over the years of the project, what had became the working copy was actually, if you went back and reflected, was actually the best case scenario. And I'd call Bill up and I'd say, I'm looking at the ConWeb system and the project plan is very angry because everything is red. It was really very stressful, but you know, you were in the project and you knew you were late and over budget. And this was like that objective evidence that, yes, something needed to change. We needed to make some changes. We went in, and that was a real eye-opening experience for us to come back in. And we actually reworked the whole program of how now we're managing the project. This concept of starting at the very end and working backwards was a real powerful way to just engage and have discussions with different resources and how they were working at that. And really challenging people between what they must have and versus what do they want to have. Not that wants are not important, but it's really if you're trying to get things done faster, make sure you have resources right, it's really important to define those must-haves to do. My early adopters, myself, and the rest of my team that have done this have been really great and part of our rollout. We too have suffered from people being transferred or promoted or moved to a different department. And there's still a couple core group of us, and so those people are the ones that are saying the mantra to try and bring people on and bring projects in and teach the concepts on to keep the concept going. Constant communication is really necessary. If anybody's on the critical chain especially, so what we've done with that is especially since we're now looking out 6 weeks, if you're on the critical chain, boom, then I can form a team, have you ready, make sure that you know you're looking now on at least a couple day basis to say, when are my lenses going to be here? Do I have everything ready? Do I have my resources lined up? Do I have my instruments lined up? Do I have, protocols written? And that's been really good. It's actually been a great forum because then it brought up a lot of other things that would have slowed us down in the past, because then simple things like, well, what are we going to call the test product? You know, this is a registration report. Shouldn't we all call it the same thing? And so it was a really good way for us to get together, because I think in the past what would happen is you'd just show up in the lab, please do this test for me. And they're like, okay. And then you'd one-on-one talk about it and just call it this and do the test. And so the report, when the study would be done, a report would go out. And then you do the same thing with the next guy. And there was no harmonization between what was going on. Or what we'd have to do is everybody's report would have to be revved up to bring that commonality in. My advice is that these new work streams, you really do bring them together, especially people who are like towards the end of the project. So my marketing people, which I keep trying to rein in, I regularly meet with them. I try to explain the concepts of what we're trying to do, that we're really all trying to work towards the same goals. Yes, the purple color is nice, but I still need this decision made by then. So they've... but it does help if you sit down with them, review those concepts, develop an operating communication rhythm. And in fact, what I say is develop a mandatory meeting, at least weekly, that they come in and they have to talk to you about what's going on in their functions or in their work streams, and report back to you on what's going on and what issues they're running into. I gave the example, the program has allowed us to track new sub-teams, so when we do run into problems, we can really assess what the impact is on the overall program of what's going on. It tells us where to focus and to go forward with. And last, these tools that we have down at the bottom that are these add-ons that we've got in project are great diagnosing tools. I find that we're going back in now. The project we started 18 months ago, and we're about halfway, we're 9 months away from our targeted launch. And we still find ourselves going in like, why did we connect these things this way? Let's really go back in. Is this really a must versus a nice to? And have been able to really challenge ourselves, rework, make sure our network is right, make sure the connections are right, and make sure we've fully defined what's needed to go forward. So, yeah, I mean, it's great. Can't imagine running a project without this system. So, good. Thanks.